Well, the House of Representatives has officially passed its second piece of legislation in response to the coronavirus outbreak, and now it's waiting on a response from the Senate.
52nd Congressional District Representative Scott Peters is here to tell us more about what the Families First Coronavirus Response Act bill includes. Good morning, Congressman. Welcome back to KUSI.
Morning, guys. Nice to be here.
Go ahead.
So just going to say, we saw the president obviously signing that initial bill of $8.3 billion in relief, and this was something that was passed by the House early Saturday morning. Tell us exactly what's in here and the sort of relief that you're hoping that the Senate will pass on as well.
Sure. Well, the $8.3 billion provided some support to federal governments that have to do with health, federal government agencies that have to do with health, whether it's the FDA or the Centers for Disease Control. This bill is meant to deal with the economy. So the first thing we wanted to do is make sure that if you're qualified for testing, if you need a test, the cost is not an issue. So that if your plan will cover it, but if there's a copay, we'll pick that up. And if you're not covered, we still want you to get tested, so the federal government would pick up the cost of the testing as it becomes available. The other thing is we don't want people to be going to work if they're sick, but even now we want mandatory 2 weeks off. So the federal government's going to pick up the cost of that for businesses of 500 employees or less. And then after that, up to 12 weeks of family leave. If you've got someone at home you've got to take care of, whether it's a child, whether it's a parent, or whether it's you yourself have been exposed, you'll get at least 2/3 of your salary. The federal government will back that up. And then we'll provide some food security for people, too. So, you know, a lot of kids depend on the school to give them lunch if they're poor. Seniors, food banks, women, infant children, there's more money in there for that too. So we're going to try to use the resources of the federal government to buffer the maximum extent possible this huge economic impact we're going to see. Well,
but these measures alone will have a huge economic impact as it relates to the debt and whatnot. How concerned are you? Is it one of those deals where you just have to deal with the crisis now and we'll deal with the financial crisis of it all down the road?
You know, it's a good question, and I think one of the things that I'm a fiscal hawk. I've been named a fiscal hero by Fix the Debt because I've voted against big spending increases and against big tax cuts so we can balance the budget. But at times of emergency, that's when it's appropriate to borrow. So whether it's a national security risk or disaster relief or a pandemic, we want our balance sheet to be in such condition that we can borrow and respond. That's what we're doing now. So in this instance, it is actually appropriate time to borrow this money, and that's the importance of a solid balance sheet, which is something we worry about over time as well.
One of the impacts that we know is going to be a severe impact on small businesses.
Right.
We're seeing a number of them being impacted already with more people staying home. What does this bill do to provide some reassurance and assistance to small businesses that might not be able to weather a storm for very long?
Well, I think there's going to be more to do, but like I said, you will not bear the cost if you're a small business of your employees having to stay home. We will pick that up for you. Inevitably, there's difficulties with restaurants that aren't being able to operate, or plays that are being shut, or various haircuts or gyms or whatever. We're going to provide small business assistance out of this bill. One of the things I think my office will be concentrating on most is connecting small businesses with those resources as they become available. Now, we have to wait for the Senate to vote on this to make sure the money's available. But as the money becomes available, we'd like businesses in our district to make sure that they're in touch with us so we can connect you with those resources and minimize this disruption. But I think it's fair to say that there will be disruption for everyone.
In recent press conferences, I heard both Governor Newsom and the president speak kindly of one another. I almost fell off my chair.
It's a crisis. People come together in a crisis, right?
So is there a mentality amongst you and your ilk to lay down our swords and shields for a second, right, and fix this as best we can?
I think there is. I mean, the bill we passed was very bipartisan. I mean, this is not a time to be pointing fingers at each other. It's a time to be cooperating and coming together as a community. And that's what we will hope will happen locally as well as nationally. And I think that that's the appropriate response to the crisis. That we know we wish we could have done it better. We wish things had unfolded more quickly, but we are where we are. And we need to work together to make sure that we minimize the effect of this, that we spread out that curve. We make sure that we don't overburden our health system. That's a role for individuals. You know, the behavior we talk about with washing your hands and maintaining social distance, staying home from work if you're not feeling well. It's also a role for employers, for our healthcare system, and for our government.
The president has indicated that he would sign this, correct?
Yes, he's indicated via tweet that he supports it, so we hope that that will give the Senate encouragement to pass it.
Before we let you go, really quickly, if you could just address really the school of thought. There's been a lot of, you know, because of the media love it, or the social media love it, or hate it.
Both.
It's it's a situation where you get to see how everybody's feeling about it, and there's a large portion who feels that this is totally overblown, overreaction. The media is making much of it. What do you have to say to those individuals who kind of feel that this is unnecessary?
Well, you only have to look at what's happened in other countries to see how serious this is, and particularly if you look at Italy right now, their healthcare system is overwhelmed. And we don't want to be in the position where, like they are, and they've actually got more beds per population than we do in hospitals. We don't want to be in the position like they are, where they're not only having to put people in tents, but doctors are having to decide who to give health care to and not to give health care to. The way we can avoid that is by behaving in a responsible way. And really taking this very seriously. So I saw one of the memes the other day is that, you know, your grandparents were called upon to go to war in Europe. You're called upon to sit on the couch. I think we can do that. Let's all be responsible. And it would be great if it turns out that we don't have these impacts, but it will only happen if we really take it upon ourselves to do the right thing and come together as a community. You know, let's take care of each other. Let's, you know, think about the elderly person who maybe can't go out. Maybe you can help that person get their shopping done. Maybe you don't have to raid the stores because you know, there's plenty of food available. You know, we don't have to be panicked, but we have to be very, very serious about this. And I think to underestimate it would be a huge mistake. And I really, so far, I'm encouraged that people are taking this very seriously.
Congressman Peters,
thank you.
thank you.